Hello, hi. As Terri recently introduced me, my name is Susan Levine, and I'm a clinician in New York City.
Can't hear you.
And I specialize in evaluation and treatment of chronic fatigue syndrome and patients. NBCFS is a disease that's well defined clinically. We know what this disease is. It's a combination of the following: post-exertional malaise, unrefreshing sleep, and either cognitive abnormalities or autonomic dysfunction. We know what this disease is clinically, however, we don't yet have a biomarker or an adequate laboratory test to be able to test people by routine laboratory testing. Over 5,000 papers exist in peer-reviewed journals covering infectious, immune, hormonal, and central nervous system findings related to this complex disease. It is not a psychiatric disorder.
Woo!
By one estimate, at least 1 million NBCFS patients exist in the U.S., and most are unable to work full-time. A lot of these patients are hidden. They're hidden in rural areas, in areas where there is low socioeconomic standards, and where there are no trained physicians. The disease affects our country very much so economically and reduces the quality of life, not only for patients, but for their caregivers as well.
Please go over.
A small number of physicians and health professionals, as well as researchers, are familiar with the clinical presentation of this illness, and we really need to find ways to disseminate information to students and to healthcare professionals, patients, and their families. Yesterday, I attended a task force on medical education in Atlanta, and what was meant to happen is we were going to interface with the Centers for Disease Control that presently has a toolkit that really does not meet the needs of most patients. So the CDC recognized that and invited us, patients, clinicians, researchers, to partner with them to try to develop educational materials for patients with ME/CFS, primary care doctors, internists, and other specialists. This is a project that's very close to my heart because I see it every day in my practice. I see patients that come to me, like Terri, who wandered all over the place and who present their symptoms and their laboratory findings, and the doctor just has no clue. Frequently, more often than not, these patients are labeled as having a psychiatric disorder and belittled in many different ways. And of course, as time goes on, they are not given appropriate treatment. And as we've learned from some of our clinical studies, the sooner we intervene with whatever intervention, the more likely we are to make an impact. So my aim is really to try to disseminate information not only to existing caregivers, providers of all sorts, not only doctors, but physical therapists, nurse practitioners, nurses, and also to patients and their families, but also to develop fellowship and training programs to train our next generation of doctors who can treat ME/CFS patients and really learn how to recognize them and make an early intervention. Identification of biomarkers is within our reach, but we need further funding from both our government and from the private sector. As Dr. Hornig alluded to, we've had some generous funding from our private sector